usually visible around the 7th to 10th day of illness. And these lesions appears in the crops and crops of 10 to 15 on the lower chest and the abdomen, and they last usually 2 to 3 days. So these lesions are difficult to appreciate in dark skinned children. So on examination, you come across rose spots, which are really difficult to appreciate in dark pigmented children. You can find the signs of bone marrow suppression in the form of anemia, petechial rashes, and due to reticular endothelial system involvement, you get hepatosplenomegaly and generalized malaise, lethargy. You will also come across coated tongue, which is an important sign and which commonly present in patients with enteric fever. So here is a common clinical features of typhoid fever in the children. There is a rate of frequency of involvement of different signs symptom patient, and this study was conducted at Karachi from 2000 children. The common presentation of all the children with typhoid fever is high grade fever, coated tongue, anorexia. These three symptoms are very common, which are present almost up to 90 to 70% of patients. Other symptoms like vomiting, diarrhea, toxicity, abdominal pain, pallor, constipation, headache, jaundice, they present in a relatively less frequency as compared to first three symptoms. So we have to ask all these symptoms in the history, because we have to correlate and we have to check for the cause of fever in different context of the differential diagnosis. There is a rose spot which I have mentioned, that they look like slightly raised rose red, and which fed on the pressure, and they are usually visible on white skin. So diagnosis. How will you diagnose the patient with typhoid fever? So the ideal and the diagnostic and gold standard is the isolation of bacilli from patient, that is in the form of culture. Culture can be done from the blood, it can be done from the stool, it can be done from the bone marrow. So the bone marrow culture is the gold standard culture for the diagnosis of enteric fever, but it is an invasive procedure, so most commonly we advise blood culture to be to isolate the organism from the patient. The other investigations to diagnose specifically enteric fever are the demonstration of antibodies in the serum. These both tests are serological investigation, in which first investigation we will demonstrate the antibodies, and in other tests we will demonstrate the typhoid antigen. So for antigen, the commonly used test was Vidal test, which is nowadays obsolete. And for detection of the antibodies in the serum, the commonly used test investigation is Tapidot, which is also obsolete nowadays. Because of the less sensitivity and specificity, both of these investigations are nowadays obsolete. The one and the only diagnostic and gold standard is the isolation of organism from the patient in the form of culture and sensitivity. Other lab investigation, you can advise for the supportive care of the patient and for the management purpose, and specifically if you are suspecting any complications in the patient. So the other investigations include the complete blood count. Complete blood count may show anemia, thrombocytopenia, leukopenia. And if the patient present with the diarrhea or vomiting, you have to know the electrolyte status of the patient. So you will see the sodium, the potassium, the chloride, the bicarb of the patient. Especially in these children, when they are anorexic, they have poor appetite, they have coated tongue, so uh, they have less food intake and less food intake. So especially they present with the hyponatremia, and again hyponatremia will further deteriorate the condition of the patient, and patient will present with lethargy and listless, not interested in the surrounding. So renal functions can be done, and liver function test, in which SGPT is important to know, and other investigation if other systems has been involved in the patient. So for example, if the patient present with the meningitis secondary to Salmonella typhi, so you can go ahead for cerebrospinal fluid detailed report, in which for which you have to go for lumbar puncture and the culture of the lumbar puncture test, CSF culture. So any body fluid, if demonstrate the organism that is Salmonella typhi, you can label that patient as typhoid fever. So now come to the treatment. For the treatment of typhoid fever, we have first line antibiotics and other antibiotics. The first line antibiotics include the chloramphenicol, the ampicillin, and the co-triamoxazole, that is trimethoprim and sulfamethoxazole. And these are the first line antibiotics. Other than these antibiotics, we have options of third generation cephalosporin, which are available in injectable as well as in oral form. Quinolone group, which also available in oral as well as injectable form, azithromycin and carbapenems. Carbapenems are only available in injectable form, while azithromycin is only available in the oral form. So this should be clear. If the patient have drug resistance, we have to start the carbapenem group of antibiotic to treat the children with enteric fever. And if the child is can be managed on OPD ground, then you can start the azithromycin in oral form. But if child does not respond to other medication, or the culture shows the XDR typhoid, then we have no option than carbapenem. So carbapenem group of antibiotic is very expensive. Treatment of carrier is not important for pediatric population, but only you just come to know that what drugs are available to treat the carrier stage, and it usually applied in adult population. Amoxicillin or ampicillin or trimethoprim, sulfamethoxazole, or ciprofloxacin or norfloxacin. Cholecystectomy may be required in chronic cases not treated by the above regime, and carriers with polylithiasis. So untreated typhoid fever or improper treatment of the typhoid fever and in the complications, the common complications are hepatitis, cholecystitis. Less common complications are intestinal hemorrhage, intestinal perforation, toxic myocarditis, DIC, and other complications which are not mentioned here are CNS complications, like patient can present with psychosis, meningitis. We have seen children with the age of 1 to 2 months. In these infant age group, the CSF shows a growth of salmonella typhi. So this is very important. If the organism is not treated earlier or in proper dose, then the organism can spread throughout the body and causes complications. So the perforation usually occur in the distal ileum, and jejunum usually does not perforate in typhoid fever, and these complications usually occur in the third week of illness. So how will you come to know that your patient have perforation. So when a patient already admitted in the ward with the history of febrile illness, and suddenly your patient develop abdominal pain, severe intensity, abdominal distension, and on examination when there will be guarding, tenderness, and rising pulse. So all these signs will direct you that your child must have some complications in the form of peritonitis or perforation. So at that time you have to immediately consult your surgical team, and you have to run for X-ray abdominal rect to look for air under the diaphragm. So this is very bad, very dangerous complication. So it is important to prevent the disease rather than we are worried about the treatment. So prevention is better than cure. So how will you prevent typhoid fever? Scrub your hands properly. This is the best prevention. Clean your hands. So simple hand hygiene and washing can reduce the several cases of the typhoid, not only the typhoid but other infectious diseases which we are coming across every day, especially nowadays as you see that coronavirus infection pandemic is also can be prevented by simple hand hygiene. So especially hand hygiene can be offered to um, the people who are concerned in cooking meal. So hand washing, drinking boiled water is very important because we have discussed that the main source of spread of this organism is fecal-oral contamination, and fecal-oral contamination of the water and the foods is very important source of spread of the disease. So we have to drink boiled water. We have to use proper cleaning of the fruits and vegetables because all these are the source of spread of the organism. The vaccine is the best policy to prevent. In recently 2019, with the help of Almighty Allah, the Pakistan Pediatric Association have launched the campaign of typhoid vaccine, which has a good impact for the spread of the disease nowadays. So we are seeing less cases of XDR and VR typhoid fever nowadays, only because of the proper campaign of the vaccine. So you will advise your family members, your neighbors, your relatives, and your other concerned people to vaccinate themselves and their kids to prevent the further spread of this infection. Thank you.